1. Which of the following is the most effective way for a gastroenterology nurse to evaluate a patient's understanding of the procedure being performed? A. Asking the patient to recall information verbally. E. Providing written instructions and reviewing them with the patient. C. Observing the patient's behavior during the procedure. D. Scheduling a follow-up appointment. 2. In curriculum development for gastroenterology nursing, which of the following principles should be prioritized? A. Flexibility in learning outcomes. B. Strict adherence to standardized guidelines. C. Emphasis on theoretical knowledge over practical skills. D. Minimal use of multimedia resources. 3. When mentoring a new nurse in gastroenterology, which communication method is most effective in fostering their development? A. Giving clear, structured feedback during routine evaluations. B. Offering informal, spontaneous advice during breaks. C. Allowing the nurse to learn through trial and error without intervention. D. Focusing solely on technical skills rather than communication. 4. Which of the following adult learning principles best supports the teaching of complex gastroenterology procedures? A. Ensuring that all learning is based on memorization. B. Utilizing real-world examples and hands-on practice. C. Encouraging passive learning through lectures. D. Focusing exclusively on visual aids and diagrams. 5. In terms of regulatory compliance, which of the following best describes the role of a gastroenterology nurse? A. Ensuring patients adhere to prescribed diets without exception. B. Maintaining patient confidentiality while adhering to HIPAA guidelines. C. Delivering medications without needing physician approval. D. Focusing solely on patient outcomes without considering legal implications. 6. Which strategy best enhances the adult learning process for nurses in a busy gastroenterology department? A. Limiting training to only basic procedures and protocols. B. Creating a structured training program that includes periodic assessments. C. Using a one-size-fits-all approach for all nurses. D. Focusing training on theoretical knowledge only. 7. In gastroenterology nursing, which of the following is a critical component of effective patient education? A. Using medical jargon to ensure accuracy. B. Tailoring information to the patient's level of understanding. C. Providing information only at the time of discharge. D. Ensuring that the patient receives information in written form only. 8. Which of the following is the primary responsibility of a gastroenterology nurse when mentoring a novice nurse? A. Focusing solely on the new nurse's technical skills. E. Providing ongoing support and guidance, including emotional support. C. Expecting the new nurse to independently manage all patients. D. Offering minimal feedback to avoid overwhelming the new nurse. 9. What is the most effective way to assess a gastroenterology nurse's competency in administering medications? A. Observing the nurse during patient care. E. Reviewing the nurse's documentation for accuracy. C. Asking the nurse to explain the drug administration process. D. Providing a written exam on drug knowledge. 10. How can a gastroenterology nurse best ensure that the learning environment is conducive to adult learners? A. By utilizing traditional lecture-based teaching methods. By making the learning process relevant to the nurse's daily tasks. C. By emphasizing rote memorization rather than understanding. D. By excluding real-world scenarios from training. 11. Which of the following methods is most effective for evaluating a patient's comprehension of post-procedure care instructions? A. Asking the patient to repeat the instructions verbatim. E. Observing the patient's ability to follow the instructions independently. C. Giving the patient a handout and asking them to read it silently. D. Asking the patient open-ended questions about their understanding. 12. When developing a curriculum for gastroenterology nurses, which factor is most important for promoting engagement? A. Ensuring content is only delivered in written form. E. Allowing learners to determine the pace of their education. C. Providing interactive and participatory learning experiences. D. Focusing primarily on theoretical knowledge. 13. What is the most effective way for a gastroenterology nurse to provide feedback to a trainee during a procedure? A. Offering immediate, specific, and constructive feedback. B. Waiting until the end of the procedure to provide feedback. C. Providing feedback only when the trainee requests it. D. Giving general feedback without addressing specific actions. 14. How should a gastroenterology nurse incorporate adult learning principles into patient care education? A. By giving the patient only written instructions to read. By ensuring the patient's prior experiences and preferences are considered. C. By delivering information in a lecture-style format. D. By providing information in a clinical language to ensure accuracy. 15. Which of the following is a key characteristic of adult learning in a gastroenterology nursing environment? A. Learners prefer passive instruction and less interaction. B. Learners are primarily motivated by external rewards. C. Learners bring previous knowledge and experiences to the learning process. D. Learners retain information best through repetitive tasks. 16. In mentoring new nurses, what approach best encourages critical thinking? A. Providing answers without requiring the nurse to think critically. B. Encouraging the nurse to analyze and evaluate patient care situations. C. Offering feedback without allowing the nurse to make decisions. D. Expecting the nurse to follow procedures without question. 17. What is the most effective way to ensure gastroenterology nurses stay current with regulatory compliance? A. Providing annual compliance training sessions. B. Expecting nurses to research regulations independently. C. Offering compliance training only during orientation. D. Focusing on compliance in isolated training sessions. 18. In gastroenterology nursing, which communication strategy best supports effective teamwork? A. Communicating only when problems arise. B. Encouraging regular open dialogue among all team members. C. Limiting communication to supervisors and managers only. D. Ensuring communication is brief and to the point without elaboration. 19. Which of the following best describes a nurse's role in promoting patient autonomy during treatment? A. Telling patients what they should do without consulting them. B. Encouraging patients to participate in decision-making about their care. C. Minimizing patient involvement to reduce stress. D. Providing minimal information to prevent overwhelming the patient. 20. When mentoring a new nurse, what is the most important factor in fostering a positive learning environment? A. Providing an intimidating, strict atmosphere to ensure focus. E. Ensuring the nurse feels supported and able to ask questions. C. Expecting the nurse to perform tasks without support or guidance. D. Focusing solely on completing tasks without encouraging interaction. 21. How can a gastroenterology nurse improve patient outcomes through education? A. By relying solely on verbal communication. B. By providing written material without further explanation. C. By engaging the patient in an interactive learning process. D. By limiting education to pre-procedure instructions only. 22. Which of the following techniques best promotes learning in a busy gastroenterology department? A. Scheduling regular breaks for uninterrupted self-study. B. Providing structured, bite-sized learning modules throughout the day. C. Relying on informal, unstructured learning experiences. D. Expecting nurses to learn independently during downtime. 23. What is the primary role of a gastroenterology nurse in patient advocacy? A. To inform patients about potential legal consequences of procedures. B. To ensure patients are fully informed about their treatment options. C. To make medical decisions on behalf of the patient. D. To monitor the patient's emotional state during treatment. 24. Which method is most effective for fostering lifelong learning in gastroenterology nurses? A. Offering a one-time training program at the beginning of employment. E. Providing regular opportunities for continuing education and professional development. C. Expecting nurses to take responsibility for their own ongoing learning. D. Limiting learning opportunities to mandatory compliance training. 25. In what way can a gastroenterology nurse best utilize technology for patient education? A. Using online tutorials and videos to reinforce key concepts. B. By providing paper brochures and expecting patients to read them independently. C. By only using verbal instructions during patient interactions. D. By restricting patient education to face-to-face consultations. 26. What is the most important consideration when evaluating the effectiveness of a gastroenterology nursing education program? A. The length of time spent in training. B. The number of nurses who complete the program. C. The improvement in nurses' ability to apply learned skills in practice. D. The amount of theoretical knowledge covered. 27. How can a gastroenterology nurse best support patients in managing chronic gastrointestinal conditions? A. By offering medication recommendations without physician consultation. By providing tailored education on lifestyle modifications and treatment options. C. By focusing solely on pharmacological treatments. D. By referring patients to specialists without offering initial support.